Vasopressin V2 receptors increase water reabsorption in the kidney by inserting aquaporin 2 channels in the collecting tubules, stimulate release of von Willebrand factor, VWF, from endothelial cells. Question 1. A 50-year-old man is admitted for evaluation of severe hyponatremia. He is diagnosed with syndrome of inappropriate antidiuretic hormone secretion, IADH. Which of the following best explains how vasopressin contributes to his condition? A. Stimulates aldosterone release in the adrenal cortex. B. Activates V2 receptors, increasing aquaporin 2 channels in collecting ducts. C. Inhibits sodium reabsorption in the proximal tubule. D. Activates V1 receptors, leading to vasodilation. E. Reduces thirst by acting on the hypothalamus. Correct answer, B. Activates V2 receptors, increasing aquaporin 2 channels in collecting ducts. Explanation. In SciADH, excessive ADH binds to V2 receptors in the kidney, leading to increased expression of aquaporin 2 water channels. This causes water retention and dilutional hyponatremia. A is wrong. Aldosterone acts on sodium, but it's controlled by RAS, not directly by vasopressin. C is wrong. Vasopressin acts mainly on the collecting ducts, not proximal tubules. D is wrong. V1 receptor activation causes vasoconstriction, not vasodilation. E is wrong. Vasopressin does influence thirst, but that is not the main mechanism of SIH-related water retention. STEM USMLE Question 2. A 26-year-old man with mild hemophilia A is scheduled for minor dental surgery. He is given desmopressin, DDAVP, before the procedure. The therapeutic effect of this drug is due to stimulation of which of the following? A. V1 receptors, increasing platelet aggregation. B. V2 receptors, promoting release of von Willebrand factor. C. Dopamine receptors, increasing clotting factor production. D. Alpha-2 adrenergic receptors, causing vasoconstriction. E. H2 receptors, reducing bleeding time. Correct answer, B. V2 receptors, promoting release of von Willebrand factor. Explanation. Desmopressin is a selective V2 receptor agonist. It increases VWF and factor VIII release from endothelial cells, which is useful in treating mild hemophilia A and von Willebrand disease. A is wrong. V1 receptors cause vasoconstriction, not platelet function enhancement. C is wrong. Dopamine doesn't play a role in VWF release or factor VIII levels. D is wrong. Alpha-2 receptors reduce sympathetic tone, unrelated to coagulation. E is wrong. H2 receptors regulate gastric acid, not bleeding time.